Assisting the patient with BEDPAN. I have my supplies. I did my opening procedure already. I have my privacy blanket, gloves, toilet paper, and wipes. Alright, I'm going to go ahead, Ms. Smith, I'm going to go ahead and cover you with the privacy blanket. Remove your blanket. Alright, I'm going to go ahead and grab my gloves. Put on my gloves. Now I'm going to grab the bedpan. The bedpan should not go down on the table or on the bed or on the floor. It should go directly under the patient. Okay? And remember, you want the flatter side underneath their butt. Okay? Alright, Ms. Smith, go ahead and lift your butt up on 3. 1, 2, 3. As soon as you put the bedpan on the patient, remove your gloves because they're contaminated. Throw that in the trash. Okay. You're going to go ahead and raise the head up about 45 degrees. The bed doesn't work, but we'll just pretend that I raised her up. I'm going to give her the toilet paper and the wipes right next to her so that she can use it. Ms. Smith, go ahead and use the toilet paper and wipes. Make sure you also give her the colic. Then you wash your hands. And then you come out of the room and give her privacy. Alright? Now she's all done. She's calling for you. You knock. Ms. Smith, are you all done? Okay, she's going to say yes. You're going to go ahead and wash your hands again. You're going to grab a new set of gloves. Okay, you can put them on right now. Put this aside. You can go ahead and lower the bed. Okay, make sure you lower the bed before you take out the bedpan. So she's now back to a flat position. I'm going to go ahead and hold the bedpan and ask her to lift her butt. 1, 2, 3. I'm going to pull it out. I'm going to go ahead and take it to the sink. Okay, dump the contents in the toilet. So you'll be over here in the toilet. Make sure you rinse it. Dump it in the toilet. Rinse it a couple times. And then dump it in the toilet. Go ahead and dry it and put it away in the dirty designated area, including your wipes and your toilet paper. They all go in the dirty designated area. I'm going to go ahead and remove your gloves. Remove your gloves because they're contaminated. I'm going to go ahead and cover the patient up with her blanket. Remove the privacy blanket. Throw it in the dirty designated area. Okay? And then this is where you would do your closing and wash your hands and all that.